In this video, I'm going to tell you the difference between the signs and symptoms of a calf pain and a blood clot. Make sure you watch to the end because it may save your life or someone else's life. Every year, thousands of people end up in the hospital or worse dying because of a misdiagnosis between these two conditions. And I'm going to share something I have seen in my years of practice that I have not seen published much in literatures. I'm going to share with you the exact strategy that I've used in the clinic in the 20 plus years I've been practicing as a licensed physical therapist to determine if I am going to be treating the patient with a calf strain or should I be sending the patient to the ER because they have a blood clot. First, let's go with the calf strain. The common signs of a calf strain is 1. The pain is usually sudden or sharp. Number 2, pain increases with movement and eases with rest. Third, there's swelling and bruising on the muscle. And number 4, usually there's no or minimal tenderness. If you find this helpful, don't forget to subscribe. Blood clot, on the other hand, has similar symptoms, but there's a slight difference. Number 1, the pain is usually described as dull or a deep ache. Number 2, the pain doesn't ease with rest and may increase with walking. Third, there's swelling on the lower leg, but the blood clot also has warmth and redness. And fourth, the lower leg is very tender to the touch. And a bonus to appear is this is something that I have seen in my years of practice, but I have not seen published that much in literature, is that the skin is usually shiny when the patient has a blood clot. And this is because of the swelling and the skin is stretched out, making it shiny. And if there is a chronic poor circulation, there also can be hair loss in a patient with blood clot. So if you have all those symptoms of a blood clot, I recommend going to the ER immediately so you can get a sonogram done. And if you think you have a calf strain, stretching your calf muscle or your gastroc will be very helpful. You can see how it's done in the video here.